Uterine fibroids is the next condition I'd like to talk to you about. They are benign or what we call non-cancerous growths of the muscle of the uterus. They're very common, quite exceedingly so. It is estimated that about 1 in 3 women actually have this condition. Usually they are not aware of it because they have no symptoms, and only symptoms start to present when the fibroids are large or depending on where their position is. Fibroids invariably are attached to the uterus, sometimes with a stalk, sometimes they're within the muscle of the uterus, or sometimes inside or within the inside lining of the uterus. They can cause multiple symptoms that depends on where they are located, from bladder and bowel symptoms, heavy bleeding, or even pressure symptoms if they are very large. It all depends on their size and location, what kind of symptoms they cause. In the 2 cases shown, here the fibroids were either large or multiple and involving the inner lining of the uterus, and this caused significant heavy bleeding for both these patients. The fibroid alone can be removed for some patients, or sometimes depending on the patient's age as well as the fact that they've completed their family, the uterus can be taken out. High-resolution MRI shows the surgeon preoperatively the location of the fibroids accurately and guides the surgeon to decide the mode and type of surgery. Again, whether we want to do an open surgery or keyhole surgery. Very importantly, MRI differentiates between adenomyosis and uterine fibroids, where the management is quite different. Another condition that we have is adenomyosis. This is a very underdiagnosed condition. It is similar to endometriosis, but here the tissue of the inner lining of the uterus spreads to the muscle of the uterus itself. This causes the uterus to swell up and become quite large. It is quite often, unfortunately, difficult to differentiate between uterine fibroids and adenomyosis. On ultrasound alone, MRI is the only diagnostic tool that is available to us currently that can differentiate between these 2 conditions. And it's very crucial to differentiate between adenomyosis and uterine fibroids because the treatment plan is significantly different.